Welcome back. Across Canada, COVID safety measures, including mask mandates, are in the process of being removed, with provincial governments saying the COVID risks are being reduced. But some health professionals have raised concerns. British Columbia ended its mask mandate for most indoor public spaces today, and joining the other two western provinces, Alberta and Saskatchewan. Next week, most mask requirements will end in Yukon, Manitoba, Newfoundland and Labrador, and New Brunswick. Nova Scotia and Ontario will lift theirs on March 21st, and the rest of the country plans to do the same next month. We brought in two infectious disease specialists to talk about these changes. Dr. Isaac Bogoch is in Toronto and Dr. Alex Wong is in Regina. And Dr. Bogoch, let's start with the Ontario perspective here. How do you feel about where your province is headed?
Oh, we're in such a better place right now than where we were 1 and 2 months ago. I mean, we certainly are seeing this Omicron wave recede, but it's also fair to acknowledge that there's still a lot of Omicron still in the province. I mean, I think this is obviously a very contentious issue and people have very strong opinions on this. My take is that we should be watching this week by week. And, you know, there will be an appropriate time to lift mask mandates. I firmly believe that. But I would wait at least a few more weeks after the spring break to see how things go. You really want to see a sustained reduction in cases and a sustained reduction in hospitalizations before you start lifting these. I think we're seeing a bit of a plateau, maybe even a bump right now, and you really want to watch that come down a little bit more before you start to lift other public health measures. But I fully believe that we should lift it at some point.
Dr. Wong, for better or worse, Saskatchewan, a leader in the country when it comes to making these changes. So you have lived in a province where there hasn't been a mask mandate for a few weeks now. Any sense of what the impact has been?
You know, so like in Ontario, you know, we've lagged a bit behind Eastern Canada with regards to our wave. And so we've seen things come down much more slowly compared to places like Ontario and Quebec. Our plateau certainly has happened and we're coming down, but that curve is not coming down as quickly as we would otherwise like. And that's probably, at least to some degree, because we removed all of our various measures and protections, you know, in February. That being said, we are definitely seeing hospitals and ICUs decompress. And, you know, at this point in time, the mask mandate's been off for about 2 weeks. And so we'll see basically how things progress over the next little bit. But we're not seeing an uptick as of yet here in Saskatchewan.
Dr. Wong, this is the first day in British Columbia where the mask mandate has been lifted for most public spaces. And I went into a supermarket. It felt kind of weird, you know, like people making the decision about whether to wear a mask or not. What's it been like in Saskatchewan? Have people been comfortable, uncomfortable with the changes?
Yeah, so again, we've been a little bit different because like Alberta, we kind of opened things up last summer. And so there was a period of time where there was no mask mandate. And again, what we saw was, you know, I think a gradual reduction in the number of people using masks. That's kind of what we've seen here. I think, you know, when I went to the grocery store about a week ago when the mask mandate was off, there were about maybe 60-70% of people in the city wearing masks. And, you know, a couple days ago when I went to the stores, maybe about 20-30%. So, you know, that's kind of what we would expect to see. I think everybody needs to feel comfortable with whatever decision that they're making. I think the good news was that, again, I mean, everybody was comfortable, respectful, I think, with one another. And again, I mean, if you want to wear a mask, either because you want to help protect yourself, your loved ones, or to protect other people, I think that's absolutely something that should be encouraged and done. And obviously, on the other hand, if people choose not to wear masks, then, you know, of course, that's their choice as well. And that should be respected just as much.
Let's talk about schools, and we went out and asked some parents in Toronto how they felt about all of this.
I think it's a little premature. You know, I think I would like to see lower numbers.
I don't love it because I have young kids who are not eligible for vaccination, so I like the protection it offers.
We're trying to keep each other safe, and I feel like this is one layer of protection, and by removing it, it's too soon.
I think that is a good idea because nobody knows what is happening. A lot of people are still not getting vaccinated.
I know both of you guys know both of these things. First of all, you know, it can be a nerve-wracking thing to be a parent and try to make the right decisions. And also there are fewer things more controversial when it comes to COVID than school policies. So I'm going to ask both of you this, starting Dr. Bogoch with you. What advice do you have for parents?
I mean, we are going to see the lifting of mask mandates across the country. I think if parents are concerned about vulnerable individuals at the home, or they're concerned about their child, you certainly can continue to mask. And obviously we've heard messaging from coast to coast talking about no shaming, regardless of no stigma, regardless of what decision people make. I think we'll still see lots of children going to school en masse, either to protect that child or to protect people that child goes home to. And that's totally okay. We're probably going to see a lot of that.
Dr. Wong, for parents who are watching, what would you say to them about their kids in school and masking?
I completely agree with Isaac, Ian. At the end of the day, I think we're going to see a lot of kids going to school with masks on, and obviously there's going to be lots of kids who won't. I think everyone has to make an individual level decision. For parents who are really worried, I think if you have the ability to upgrade your kids' masks to a respirator style mask or an N95 or something like this, that is going to provide better protection. Obviously, remembering to have your kids fully vaccinated and boosted as you're able, I think will also help to optimize protection as well going forward. So we continue to encourage those things and recognizing that the masking piece is obviously going to go across the country in the near future.
And before we go, one more issue. I want to play a clip here from Toronto singer Alex Pangman, who is immunocompromised. This is her reaction on masking.
I feel horrified. Like this is like implying that it's all over, when in fact, for immune suppressed people like myself, this is far from over. And it just feels a little bit discriminatory. Nothing's going to change for me. I'm still going to have to be in my bubble. My quality of life will be impacted. My career, my ability to work will be impacted.
I don't have a specific question, but I will go to each of you. Dr. Bogoch, beginning with you. Given that some people are feeling a high level of anxiety, particularly if they're immunocompromised, maybe a last word to each of you, starting with you, Dr. Bogoch.
We have to approach this with empathy, right? There are many among us that are at greater risk of severe infection, and we should be taking steps to really protect everybody, including those vulnerable individuals. In the same breath, I mean, it's hard to reconcile, but COVID's not going anywhere, and this is going to be here for a long, long time. We do have to find a way to move forward. And of course, we have to find a way to move forward with creating as safe environment as possible for all Canadians.
Dr. Wong?
I agree with Isaac. I think, for many people who are medically vulnerable, immunocompromised, who are anxious about what these changes are all going to bring, I think, again, the individual level steps that you can take in terms of optimizing your vaccine, whether that be 3 doses or 4 doses, whatever you're eligible for, in combination with a well-fit respirator, no matter what everybody else around you is doing, that's pretty much going to help to keep you safe from pretty much any respiratory virus. So take comfort in that measure that you can take at an individual level for yourself. And again, at a societal level, we certainly need to be respectful of those at risk, those medically vulnerable, as we kind of move forward, finding ways to do things safely and responsibly.
Continues to change, but 2 years ago today, the pandemic was declared, and here we are talking about COVID still. Thanks very much to both of you.
Have a good one.
Take care.